I think if it's truly like a cervical component to their symptoms, I mean, a lot of times it could be three times, three visits. I mean, and you'll be great. But I think finding out, improving their posture, improving some of the mechanics, getting them into different routines, either yoga or whatever you find that you feel like it's picking at it, and that's just a good discussion. That's wholehearted with your clinician and really trying to work together as a team. I find that the good cases, those are it. Now we do have the other end of the spectrum where these individuals are much tougher, and that's where you really need to make sure that you consult with the vestibular therapist, make sure there's nothing going on that component, um, or you need a little bit more specific type of exercise component, especially if someone's had some like a trauma, like they maybe were surfing or something, their head hit the bottom of the sand in the ocean, and they started with neck pain then, and you're talking about, all right, well, we've got a little bit different than it just kind of arising without a traumatic event. Um, Traumatic event typically is a little harder. It depends on what it is, especially if it was some sort of head injury. So that barring aside, those are a little tougher to give. I always tell people, give me a few sessions, I'll give you more prognosis at that point. But if it's truly like you just woke up and you're having some of these symptoms and we can precipitate from the neck, you ought to knock down the actual otoneurological signs pretty quickly. But then you've got to, from a patient standpoint, I really tell them, like, you don't want this to happen again. Let's find the root, the cause of it, and get you to attack that. And that's the part that I think from a home run standpoint they can do. And then they learn their signals. They're like, oh, kind of feeling a little something before it really shoots through the roof. Go and do this that we found to be effective. See if it knocks it back down.